1 second. Share screen.
Manoj, you make it online, YouTube online.
Yes, I'm just doing it right now.
It's right there now. Okay.
Exactly after 1 minute, you can start the talk because you can start the program. Okay. Now
Yes,
it is
sir.
17:29. Exactly after 1 minute.
And I assume you can see my slide.
Yes, ma'am.
Yeah, we're seeing.
Ma'am, please make it full screen. Yes, perfect.
Yeah.
And no.
So I made everyone mute right now. We'll start exactly in 2 minutes.
Meera, ಹೇಳಮ್ಮ. Hello, hello.
Good morning.
Good morning,
Good
Rajgopal
morning,
sir.
everybody.
Sir, it's already 5:30. Shall we start?
Okay, I can start with the introduction. Okay, should I start?
Yes, sir,
Should I
please.
begin now?
Yeah, please go ahead, sir. Thank you.
Good morning and good afternoon. This is G. Jagadish from US. It is my privilege to introduce today's speaker, Shobha Patachar. She did a graduation from Government College of Pharmacy, the Pharm in 1985, followed by Pharm in 1987. Later on, she moved to US and she did her post-graduation again at the University of Kansas, which is a very famous university, especially for the pharmacy program. It's very well known, and most of you must have come across the department's accomplishments. And she did it. She did her M.Pharm Pharmaceutical Chemistry in 1989. She joined Pfizer, and she worked there for about 8 years. And then she moved to Eli Lilly, which is in Indianapolis, Indiana State. And there she's working as a scientist and director, and she has involved in development of various pharmaceuticals, small molecules discovery, and also she's also involved in the clinical pharmacology work. She has published extensively, and of course, I got her book, which is edited, and she has also attended several conferences, presented in those areas which are defining that development of pharmaceuticals, translation pharmaceuticals, and most recent publication is her chapter in Berger's Medicinal Chemistry. Of course, we have gone through this Medicinal Chemistry edited by Berger. It's a very famous one, which I know that all of us studied at during our undergraduation. And she has a chapter in that book. She is an active member of the American Association of Pharmaceutical Scientists. And also she has a hobby of teaching at Chinmaya Mission Balavihar, which she enjoys so much. And today's webinar is second in our series. This GCP has started recently to manage regarding this COVID, how it is managing in India. So here she will be discussing about the informed decision and in home care, and later on when a patient moves to hospital, that is there what care is being taken, what are the medicines prescribed, how it is moving from once they get infection to that of discharge. She's going to brief all these procedures, and please keep typing your all the questions whenever you have some doubt, and to our utmost knowledge, possibly to best of our knowledge, we should be able to answer your questions. And also from the panel, people can also hear if they have got any solutions or any suggestions on this talk, they are most welcome. Thank you so much, and I will request now Shobha to take over. Shobha.
Thank you, Dr. Jagdish, for that kind introduction. I would like to start today's presentation by remembering Srimati B.K. Rohini. Today's presentation is dedicated to her memory. She was our beloved librarian who set an amazing example of commitment, honesty, integrity, love, and undying friendship to so many of us. Sadly, she lost her battle to COVID-19 just a few days ago, and without her help and assistance, many of us would not be where we are today. So let us pray for her soul to rest in peace and for her family to bear this untimely loss. With that, thank you once again, Dr. Jagdish, for that kind introduction. And I would like to begin with an outline here. And also, just FYI, we will be running a few polls throughout this webinar. So we would like for you to be near the device wherever you are, so you can participate in this poll. So first off, this is the second webinar. The first one was presented by Dr. Prakash Parab, and this is a part, he spoke on the precautions and prevention of COVID-19. So following along from that topic, today we will focus on treatment, detecting and tracking symptoms, and critical decision making. So why are we doing this? Our primary objective is to engage in an educational and scientific dialogue with the GCP community. This is a measure to enable participation and for us to contribute our efforts to overcome this public health crisis that we are in. As a disclaimer, the information provided in these webinars should be treated as general guidance that is available at the time of this presentation. And in all instances, the prevailing local treatment and protocols and processes and the views of the local medical leaders will prevail and will supersede what we talk about here today. But that said, though, we are students of a great college, GCP. We have some knowledge that we're able to disseminate and have useful conversations among people. And we'd like to put this knowledge to use to participate in whatever way possible to help us overcome the pandemic that we're in. It's not a time to be complacent. It's a call to action. And so that's our objective here, to invite you to participate in this dialogue. So our poll question number 1, and I request our host, Mr. Manoj Kumar Yadava, to please post this question in the poll. Manoj?
Ma'am, I have posted the link in the chat room.
Great. Okay. So we will give 10 seconds for people to respond. Have you had a COVID-19 infection? Yes or no? Right. I think we can close the poll now and we will move on to our next slide here. So what are some of the key features of this second surge that we're in? A few thoughts that come to my mind at least. So one is traceability of the first contact has been extremely difficult with this second surge. It's been spreading much faster and transmitting across longer distances than originally thought. Testing is neither fast enough nor scalable, we're finding, especially for the large populations in India. Contact tracing is nearly impossible. This has overwhelmed our healthcare system, but it's teaching us many new lessons. There's a lot that we did not know even a few months ago that we know quite well today. There are several unresolved questions yet that remain to be answered, which is why communicating proper scientific information and doing what we can in our small part is extremely important in the situation that we're in. So we'll start by talking a little bit about the infection itself and how the virus actually integrates into the cell. So if we think of this 7-day calendar that I'm showing here on this slide, the virus, let's say, enters the body on day 1. It lodges on the membrane of cells in the pharynx, in the pharynx, and then from there on, it integrates into the cells. It then takes over cellular metabolism and begins replication. More about that in a moment from our expert here. But for now, so then what happens after that is extremely important because we may never know when day 1 actually occurred. But generally speaking, in 3 to 7 days after that first infection, symptoms will start to manifest. The most common symptoms are fever, body ache, sore throat, and occasionally some GI symptoms. And I say 3 to 7 days because when you talk about any biological process, a number can never be a point estimate. There's always variability and uncertainty, and so it's always a range. And that's why it's important to pay close attention. So what's extremely important here is to track the start date of these symptoms because it's that date that matters. It's not the severity at this stage. It's not the severity or the specific symptom, but the start date is extremely critical. I cannot stress that enough. So whether it's the most annoying symptom or not, it's whichever one of these was, when did that date start? It's important to track that. And then what happens is that after the initiation of these symptoms, generally about 4 days after that, once again, it's a range, it's not a date. So then in about 4 days, the symptoms will start to recede. This is about 80% of the population will get better in about 4 days. But it doesn't happen in all instances. There will be cases where symptoms will start to get worse after about 4 days. And this is where it becomes extremely important to monitor very closely. So at this point now, I would like to engage this audience in a bit of a deep dive into the mechanistic aspects of what's exactly going on here. And as you know, it all begins with the ACE2 protein on the cell membrane making contact with the spike protein on the COVID virus. And so who better to talk about this than our resident expert, Dr. G. Jagadish. His expertise is actually in the renin-angiotensin system. He has been working for many years at the FDA and has deep technical expertise in this topic. And so I would like to invite him at this point to talk us through these next 2 slides, please, Dr. Jagadish.
Thank you very much, Shobha. So this one is one which I got this slide from one of the publications. You know, the natural, we got natural immunity, that is the innate in the body. Whenever there is a virus attacks, you see that how the killer, I wanted to take out this animated one to show you how it gobbles up the virus when it comes there, and killer T cells, they eat away this virus. And okay, can you move this next one, please? Okay, go ahead.
So, okay, I will come back to that in a moment. So what I wanted to insert at this point is that when we say worsening of symptoms after about 4 days, what exactly do we mean? So the fever that sets in, before that will start to either linger on or get worse. Breathing will become more labored even while the patient is resting. What used to be a mild cough could turn into a hacking, unproductive cough. And it's at this point that it's time to get medical help without losing any more time. And so then what is going on here, we'll get into the biological aspects again in a moment. Dr. Jagdish will walk us through that, but just to verbalize it at a high level here, what's going on is that the antibodies to the spike protein will start to attack similar proteins, ACE2 proteins, that ACE2-like proteins that are present in blood vessels within the lungs, GI, liver, and kidneys. And as they do that, these antibodies will cause damage to the vascular endothelium in these regions. And then the cellular components of blood start adhering to the damaged endothelium. Clotting begins to occur and vascular supply is affected. And it's at this point where the oxygen CO2 exchange is affected, oxygen saturation starts to drop, and it becomes important to measure oxygen saturation. So back to Dr. Jagdish.
This is the one which a famous article came last year in the Science by Wardman, showing that how the infection starts, because the nasal and from the mouth, this virus can enter, where it is dense of ACE2 receptors are being present. And when they enter through the area and directly it goes into the via the larynx to the lungs, you see that the first attack, the site of attack is the lungs, and it makes it lungs so fragile, which also we'll be seeing in the next couple of slides, a mechanism showing that how this lungs become the ground for the infection. So you see the ground glass, the area becoming, and this damage taking place first in the lungs, then they move towards the various other organs, which is like heart, kidneys, and the brain region also. Okay, Shobha. And okay, this also I can explain about this one by rampaging, showing that how the clot takes place in the blood vessels, which when it causes the endothelial injury, there is a leak in the blood vessels, and the leakage starts with the platelets aggregation, causing the clot. Next one, please. Now this will, next slide, will show the mechanism, which most of you might have seen this kind of slides in publications. I will go over this thing step by step here. Okay, I don't, okay, I can move this one. I don't know where I can say. Okay, anyway, I may not be able to use my pointer. Okay, soluble, first step is attachment. The virus coming from outside, you see, that is, virus is made up of four structural proteins, MENS, that is the membrane, envelope, nucleic acid, and spike protein. Besides that four structural proteins, it also contains 16 non-structural proteins. The spike protein is one of the proteins, that is the structural proteins, which attaches to the receptor binding domain of the ACE2 receptors. Before attaching to this one, it has to be primed by two enzymes. One is the TMPRSS2 that primes it, so that S1, S2, that is the part of the spike protein should break. That furin breaks this S1 and S2, and so that S1 can bind to the receptor binding domain of the ACE2, and then it orients so that S2 can go and attach to the cell membrane, that is causes a fusion. See how it is tilted and then enters inside the cell. There are various steps where I'll come across later on the drugs, how they act at the different sites. So first I'll show you how to the initiation. Initiation, fusion. Second step is fusion. Then it causes the proteolysis, that is the cell membrane breaks, and the virus, that is messenger RNA, is being released inside the cell. Now it gets, once released, it hijacks the messenger RNA, the ribosomes, and gets multiplied. See the fourth step here, transcription and translation. Well, it is polypeptides, PP1A and PP1AB. These proteins, and these are all non-structural proteins which are being released, synthesized. And at this stage, there are drugs can act here. One of the main enzymes here is RDRP, that is RNA dependent RNA polymerase, that is non-structural protein 12, which will act upon these proteins to multiply here and duplicate. This RNA strand is duplicated. At this level, remdesivir can act. These are the site of action of remdesivir, that is inhibiting this RNA dependent RNA polymerase enzyme. Once this is the strand is duplicated, it number 5 is packaging and wire assembly on Golgi apparatus. They will be sitting there and they get assembled together, and that virion gets matured, and through exocytosis process, number 6 step, where it is released either by budding or by pushing it. Exocytosis, you might have seen that in case of nerve endings also, how the neurotransmitters are being released. Similar fashion, it gets out of the matured ones, releases, and infects more and more cells. Lung cells, for example, here is shown here, where it attacks the lung cells. And when it attacks here, now the cytokines are being released here. This is the process of how number 1 step, attachment of this virus to the ACE2, and then moving through 2nd, 3rd, 4th, 5th, 6th step, released here. Now they're talking about the drugs I've shown here. Number 1, first is attachment can be inhibited. There are 2 stages where virus can be tackled. One is the virus factor, second one is the host factor. Number 1 is the host, that is the virus factor, where you prevents this attachment, prevents this priming, everything. That is, for example, chemostat. Chemostat is being approved in Japan, but not in other countries, not even in US. Still, they are considering. Clinical trials are going on in this direction. How to inhibit this enzyme, furin and TMPRSS. To a lot of drugs have been synthesized, being tested to detach the virus from attaching to ACE2. Number 1 step. Number 2, the famous ARBs, that is the 81 receptor antagonist. They can also inhibit 81, which is mainly used for as an antihypertensive agents. They could be able to decrease the ACE2 receptors, so that decreasing the load, you should be able to overcome the attachment of this virus to the ACE2 receptor. Next step is the proteolysis. That is hydroxychloroquine is the one which is able to increase the endosomal pH here, because if acidic environment, they were not able to survive. So proteolysis, we are able to inhibit the attachment to this, and releasing the uncoating can be prevented. That is the 3rd step. 4th step is RNA transcription translation, where is lopinavir, remdesivir, lot of this with the suffix VIR, antiviral agents are able to act. Then the last step, coming to that host factor, that is the once it being invaded, how you treat, which is that Shobha is talking about, that one, how the prevention. Because first, if you're not able to tackle with the virus, prevention, then next is the comes the host factor, that is the cytokines which are responsible for causing extensive damage in the body, involving lungs, heart, kidney, and other organs. So those things, how we are able to tackle, this is the one next which she is talking about. Okay, next one slide, please. Now, this is the overall picture, gives how the cytokine storms being set up in the body. As you saw in the previous slide, that is being invaded by the virus when it matures and releases and attacks lungs, kidneys, and all other tissues in the body, and meanwhile sets up the cytokine storm. And the main culprit in this case is the involvement of angiotensin 2. This also basically we study in pharmacology, that is the substrate angiotensinogen is being formed in the lungs and the liver. They're the rich source of angiotensinogen. The substrate is being cleaved by the enzyme coming from the kidney, that is renin, which breaks into form angiotensin 1 and then forms the main hormone angiotensin 2, that is the 8 amino acid octapeptide angiotensin 2. That is the one which is main required by the body for maintaining the blood pressure. But when it overactivates, all these things happens. Because of lung injury, ACE enzyme is being released. This released ACE enzyme is able to produce more and more angiotensin 4 to 6-fold of angiotensin is being formed. And those people who are taking ARBs or ACE inhibitors for treatment of hypertension, they should be able to see a decline in this angiotensin action. But however, the angiotensin 2 may do damage in the lungs when they're able to find the receptors in the blood vessels. They may also have elsewhere effect. The angiotensin 2, see, while acting on the AT1 receptor, what does it do? There are multi-pronged approach for AT1 receptors. One is through the endothelial cells, it's able to release endothelin, which in turn it releases transforming growth factor beta 1, which generates plasminogen activator, inhibitor, fibronectin, collagen synthesis, which results in end organ damage as well release and damage to the blood vessels, which in turn releases inflammatory cytokines, interleukin 1 beta, interleukin 2, interleukin 6, and tumor necrosis factor alpha. Then again, vascular endothelial growth factors, granulocyte macrophages, colony stimulating factors, and all of these things which are released, they will be able to act upon the blood vessels to cause platelet activation, aggregation. This is also being formed from MAP kinase, which are being stimulated by AT1 receptors, which are having again two-pronged approach. That is MAP kinase stimulation with various kinases, of course, including this JNK stat and JK receptor, tyrosine kinase, all those things. Plus, the reactive oxygen species ROS is also being formed through NADPH oxidase. You know that ROS is very dangerous one. That's why body needs antioxidants. We always talk about consuming more and more antioxidants to overcome this ROS, and main thing, stimulation of the transcriptional factors like NF, kappa B. That is one which induces this cascades, and those also causes endothelial dysfunction, necrosis, through which we will be able to get the platelets released in the blood vessel side, and that activates, which aggregation takes place, which also Shobha will be talking about this anticoagulants therapy at this stage, where neutrophils are being recruited to cause the damage. Thank you very much, Shobha. I think
Thank you, Dr. Jagadish. And so before we go on to what to do and what happens with this machinery, our second poll question, please, which is, have you or a family member living with you needed hospitalization for COVID-19?
Ma'am, I've already circulated this question as well in the group.
Okay, great.
And
thank you.
So far, 20 people have responded to the first question and the second question.
Okay.
For the first question, have you ever had COVID-19 infection? Nobody says they had. So there is no 100% no response.
I had one. I had COVID.
Okay, so kindly use the link to respond, sir.
No, that link is not opening. That link is not opening. I'm trying since these things. For both the questions, I have no. My answer is no.
All the questions are in the same link, sir. Already 20 people.
No, it's not opening. It's not opening. I'm clicking there, the link, and it's not opening.
Okay, I'll send it again one more time. So 20 people have already.
No, there are 3-4 times you have sent it. It's not opening. That is the problem.
Okay.
Okay. Well, we tried. Maybe we can find other ways to help people to respond. So again, with this was, have you or a family member living with you needed hospitalization for COVID-19? I actually happen to know some people who are in the audience who would say yes to this question. But it's too bad that some people are not able to figure out how to participate in the poll, but let's keep going.
Yes, ma'am.
So
21 in this case have responded, and only one says they have one person suffering.
Needed hospital.
Yes,
okay.
Yes, yeah.
Thank you, Manoj. So moving on then. So we saw how the whole machinery is triggered once the virus starts to integrate into the cell, and which then culminates in the cytokine shower. So what we're talking about at this stage during this webinar is, how do we treat it during this cytokine shower? And especially when we're doing this at home, but under the strict supervision of a medical practitioner. So the first step is that based on tracking and reporting of symptoms to the physician, The physician in charge will start the treatment, which could be on the 4th or 5th or 6th day. As I said, there's a range here. We're talking about biological processes, so it's not a day, there's always a range. When worsening of symptoms will start to occur. So then, standard medications might include an oral or parenteral steroid, which might be needed for 10 days, and then an anticoagulant therapy for up to 3 weeks at the discretion of the healthcare provider and or prevailing treatment protocols. Note that standard guidelines are not available at this time for this treatment, and I have a couple of references at the bottom of this slide. Sorry, I could not insert a QR code here, but the slides can be made available later. Get into details of the preferred type of anticoagulation treatment, whether it be heparins or aspirin or others. There's an ongoing dialogue on what the best approach is. But as I said, whatever the medical practitioner and the local prevailing protocol might be, that's the way to go. And then, so that's the way to treat that anticoagulant therapy. The third one, if fever comes back while on the steroid or anticoagulant treatment, then an antibiotic like doxycycline or azithromycin might be added. This is generally due to a secondary bacterial infection that the patient might be suffering from. Next, the patient might require oxygen, which is still doable at home in some instances, where up to 2 to 5 liters going up to, in the worst situation, 60 liters of oxygen to keep the brain functioning. And this could be done either using a BiPAP or CPAP, or again, in the worst cases, with a ventilator. But obviously that part will need hospitalization. Also, if the patient has comorbidities such as diabetes or kidney conditions, then the treatments that we just talked about, such as steroids and anticoagulants, will have to be managed very carefully, and that again will be in the hands of the doctor. Our job here is to stay informed and to aid in all of these processes. So with that, then, some of the common mistakes that we need to be aware of, because they can be dangerous. The first one that I'd like to talk about here is, do not start steroids in a proactive manner before the onset of the cytokine shower, because if you do, then it will extend the viral multiplication phase. Start only after the viremia phase ends and the autoantibody phase has set in, and that's why it's important to track the progress. Second, if the healthcare provider prescribes an anticoagulant therapy, do not stop therapy as symptoms improve. Continue for the prescribed duration of treatment, because in many cases, the clotting risk may still remain beyond the improvement of the symptoms. Third, do not rely on oxygen saturation alone. It can be highly misleading sometimes. Also, starting antibiotics earlier is a big mistake, because this will cause resistance. And this is where us as the pharmacist community can play a big role in making sure that misinformation does not spread and that people get proper guidance. Lastly, manage steroid use carefully. Steroids are diabetogenic and can also affect the fluid balance. For individuals who are pre-diabetic or diabetic, glucose control can be messed up. For people with pre-existing kidney problems, fluid imbalance can occur. So the steroid use has to be managed carefully under the guidance of a doctor. Which brings us to poll question number 3, if it's working. For whoever one of you it's working, please participate. Are you playing an active role in the management of this pandemic in your town or local community?
Yes, ma'am. 34 people have responded, and 41 say yes, 58.8 say no.
Fantastic. That's awesome to hear. Thank you, everybody. So with that, we come to the key takeaways, which is, do not underestimate the importance of tracking symptoms. Testing may not always be available, or even if they are available, turnaround of results may be delayed. After about 5 days of appearance of the first symptoms, if you're asymptomatic, all good. This happens in a majority of patients. But if symptoms start to take a turn for the worse, take medication under the close monitoring of a physician. If this phase of treatment is missed, hospitalization will be needed, and we should try to avoid it to the extent possible. So with that, before we jump into Q&A, we want your feedback, obviously. So was this webinar informative? And then the next question is, what would you like to hear about next? So obviously, I'm not a subject matter expert in the topic that I just went over. But as I mentioned at the start of this webinar, the objective here is for us to understand what's going on to the extent possible and to be stewards to the extent that we can be to help battle the pandemic that we're in. And that's all I had for today. I would like to open this up for any questions that we might be able to answer. And if I don't have the answer to a specific question, I'm going to call on some experts to chime in, please.
Thank you so much, Shobha, for an exciting talk and managing this COVID at home as well as at the hospital. And a lot of people are taking very active participation in this process. Really, it is very thrilling to note down that people are involved in community work also. Anyway, now we are open for discussion, and people are encouraged to discuss by way of asking questions, short answers, so that we'll be able to accommodate. Last time we had 30 to 40 questions to answer. And I would open up the forum. I'll begin with Prakash, as he has gone through a lot of things, and he has got something to say before we take up the general questions. A lot of questions are coming. People are typing up. We'll give some time for them to type it, and meanwhile, Prakash can talk something about it.
Yeah, well, very good presentation. Thank you. Very informative. As you said, we are pharmacists, so it is up to the physician because it is very complex. As you said, it attacks lungs, kidneys, and heart. As you said, it's very important. Look at the symptoms of the patient, where the doctor you have to tell what your symptoms are, where the doctor can treat. I had COVID, but I had mild COVID. Most of my symptoms were shivering and fever. And I started with vitamins and took acetaminophen, Tylenol, and hygiene and all. Worst thing happened on the 9th day. I started sleeping 15 hours a day, and I stopped everything, took a rest. Okay, so that was my story. And recovery, I started eating good food, and recovery, I was very tired. So recovery takes a time. So you give it time. I did, but I tell you, when I had COVID, I did yoga exercise. I did breathing exercise. I walked around. So my circulatory system was good, okay? But I was isolated in my room. I kept my family separate and all. Then my brother was in hospital for 2.5 months in India. And every day I was constantly in touch with my niece and getting the blood data and all. So they were also in India, they were doing coagulation factor and monitoring the anticoagulant to be given. And they were giving antibiotics, steroids, and all that. His oxygen level had fallen to 40, and we were worried. Then gradually it kept up. But I was only sending positive message to my brother on his phone, kept him meditate, and positivity is very important. So thank you. I have no more comments. It's very complex. We are learning every day, and posture is very important in the United States. Posture is very important because the lung is damaged. You want to keep recovery of the lungs depends on the posture. So please That is very important. I'll request the patient. The patient may not be able to sleep on the back. He or she is tired. Try to make them sleep on the side, stomach at least few hours. Then they can sleep on the back. Those are my comments, Dr. Jagdish. I have nothing to add. But one thing, why not we are talking about plasma treatment? Because the patient who had COVID, they can donate the plasma with the antibodies. Why we are not talking about that? My question.
Sir, there are few questions on the chat box. One
I
is
see that Dr. Srikanth
no, not
regarding
that.
development of liposomal amphotericin B, Dr. Amsa Shetty should be, because he is former student of A or GCP, and Dr. Amsa Shetty should take up this issue, invite him. I read his report and everything online. Really nice one. If you could arrange his talk, Dr. Professor, Principal.
Sir, there are few questions. How to take care of post-COVID? That is the first question.
Yeah.
Second one is, can ivermectin be used as prophylaxis? I think it was asked in the last question itself, last seminar itself. Then the third is, what diet will be preferred in COVID infection? These are the three questions, and then we can go for the other questions. First one is post-care. Madam?
Well, I would like to invite one of our Prakash or Dr. Jagdish to chime in on this, actually, on the post-COVID care.
Post-COVID care, as I explained last time, it depends on the damage. It might have done damage to your lung. It might have not done any damage. You may be tired, pretty tired, weak, and loss of weight. And in the serious condition, your hemoglobin count goes down. So blood analysis and looking at the data and asking correct treatments with the doctor is very important, okay? As I said last time, if you have a cardiovascular damage, lung damage, then the internal medicine brings in the experts to look at and diagnose, and proper treatments will start there. But keep positive attitude, take positive treatments, and that is the way to move up. Recovery can be from 5 days in youngsters to 6 months, depending on the age, your health condition, and the damage. So nutrition, medicine, exercise, and meditation. Those are the 4 things you remember.
Sir, there is one important question about the fungal infection. This fungal infection is infected only for people who are admitted to hospital or home quarantined people also. Please explain.
Okay, so I'll start, but I know that others will continue. I just wanted to stress on the importance of not misusing steroid therapy, because steroids can compromise the immune system and trigger these secondary infections such as the fungal infection. So as to what to do about that, and is it more prevalent in the in-home care or hospitalization, I'd like to let one of the others respond to that.
So I have got 3 more answers. The 3 types of answers for this. You see, fungal infection will be affecting the persons who are on steroid therapy, because they are all immunosuppressant, as Shobha told. Second point is, if they are improperly using the tubing in the oxygenation, that is non-cleaned tubing. Third one is, even though they are home quarantined, if they are using concentrators, the tube shall be cleaned properly, and they should use sterile or at least boiled water. If they don't use, again, that moisture leads to the fungal infection. The third point is comorbidities associated with, that is like diabetes or HIV, who are immunocompromised already. These are the 3 reasons which have been quoted in India right now for the.
I heard also, learned that in the hospitals, when there are oxygen is supplied to multiple patients, there is a water there, and that water which is there in multiple systems, The water, if it is not distilled water or pure water, nice water used, you have used a well water or something, this fungus is there everywhere and in the well water, then you are impacting the patients in the hospital.
And there is one question by Mr. Raghavendra, son of Rohini madam. He has got two questions. One is, when should steroids be started? I think in the lecture, Shobha has already cleared it. It shall be started only if the things worsen after the 8th day. Second is, can plasma treatment be started on a person who is partially vaccinated? That means who is vaccinated only single dose. Partially means single dose. She is awaiting for a person is awaiting for the second dose. Can we give the plasma therapy? This is the question.
I think plasma therapy can be given. There is two different things here, okay? Plasma therapy can be given in monoclonal antibody in the United States available, that can be given. Yeah, that is my opinion. And I tell you, I never read anywhere that plasma therapy cannot be given if you are taken for one dose of vaccine.
And there is one more question. What is the diet that will be preferred during COVID infection? I feel diet, as per when Dr. Jagdish was speaking, he has told about antioxidants. So probably antioxidant-rich food shall have to be added to the patient, like pulps or green vegetables and so on. I feel that may be given. And there is one more question on ivermectin. Is there anyone who can throw light?
Dr. Narsimurthy is there on this panel because he is making some trials. Dr. Narsimurthy, I invited him to take participation. He said he will join from Mississippi.
He has joined, sir.
Ah, okay, he's joined. Dr. Narsimurthy, can you pitch in? Dr. Narsimurthy?
Can you hear me, sir?
Ah, okay.
Yes, we can hear you now.
Okay, please go ahead.
Yeah, I didn't get the question. I wasn't.
Regarding ivermectin.
Ivermectin.
Are you people making any trials at your place, at your university, on ivermectin?
Not really, Dr. Jagdish. I've heard on both sides about ivermectin. I've seen some papers being published from Israel and a few from UK group that it would be helpful. But there are some papers which are saying that it may not be all that helpful. It could just be an adjunct therapy. I really don't have a conclusive report on the use of ivermectin. And even in India, I see that some doctors are prescribing ivermectin, some are not.
No, not only some doctors. Even politicians are saying whether you are having Goa Chief Minister clearly stated that whether you are having infection or not, you take 3 doses of ivermectin every day for 3 days.
Okay, so this is where we
one thing, politicians should not get involved. Politicians should not get involved. I tell you, he's not a god. And I tell you,
I'm not telling you God, I'm not telling you.
No, the thing is, you are taking antiviral, and antivirals have side effects. You have to be very careful in the treatment. Already the patient is sick, and then you are bombarding with antibiotics. Then steroid is to calm them down. Then you are treating with the drugs which are not been proved to be effective and safe. So people have to be very careful. It shows the data.
Right. So we're talking about a very fine balance between.
There is one more question, madam. How does the time period between 2 vaccine doses, some say 42 days, some say 84 days, for effect of the efficacy of the immunization? In India, first they said that within 1 month. Later on, they said that after 6 weeks. And now they are telling that after 12 weeks. Which is right? That's what is the question by one YouTuber, one Vishesh Reddy.
In
How come it is going on increasing?
In the United States, the guidance is After the second dose, 7 to 14 days, after 14 days of the second dose of the vaccine, you are fine.
No. His question is what should be the time period between two doses?
It depends. It depends on the vaccine. In the US, the two most common vaccines are the Moderna vaccine and the Pfizer vaccine. The Pfizer vaccine is taken 3 weeks apart, the Moderna 4 weeks apart. So it really depends on the mechanism through which the vaccine is acting. And so it is variable.
So in India now, it is Covishield and Covishield and Covaxin are there. Covishield, they say now 84 days. Government has declared it on the basis of the recommendations of the experts in the country. They now said that 84 days.
No, I see. It's actually ongoing. Most of the trials are done Pfizer as well as Moderna for 3 weeks and 4 weeks. This was prior to releasing the product, but later on, as it being used, there is a continuous, research. So this tells us that the antibody production and can be used as long as you delay. It's not too much. And also the scientists will understand the level of antibody in the body. So the second dose is only a booster. So the reason is if it's not available, there is it's a short supply. So it is very reasonable and rational to delay the second dose, and it's not going to harm the patient. It's actually, as most of the scientists or the doctors or the medical care has established, it's probably more beneficial than less beneficial to delay the second dose. I don't know about 84 days or 90 days, but definitely more than 4 weeks, 6 weeks is ideal. There is no harm in delaying the second dose.
Thank you, Ravindra. That was really nice and clear.
There is a question coming from Rohini's, that is Srimati Rohini's son. He says, first of all, thank you for hosting this and dedicating this to my mom, which Shobha has done it. And he has two questions. When should steroids be started? Second question is, can plasma treatment, which also discussed by Prakash, can plasma treatment be started on a person who is partially vaccinated? I don't know, this is not correct. Can plasma treatment be started on a person who is partially vaccinated?
I think this was answered by Prakash already.
Yeah, can be. Can be started, please.
Because there are two different things.
Yeah. You can please start plasma. If you get a plasma treatment within first to 10 days, very, very important. If someone is donated, correct quality, correct thing, please take it.
Ramya says, she asked the question, is death rate increasing due to medical errors? Our patient is not responding to the treatment. What is the reason for why death rates are increasing in India? She has got a question because why it is escalating.
It's a difficult question to answer because death can be associated with comorbidities or treatment, delayed treatment may not always be due to treatment errors. So I don't know. It's a difficult question to answer.
And we don't have the data hospitalized. Most of the patients who are hospitalized, we know that we can calculate percent of the people going to hospital, what is the fatality rate, okay? Previously it was 2%, then it increased to 5%, then it increased to 7%, 10%. So we have to get the data in India. Data talks. If the data is available, that's the way to look at.
Dr. Rupesh Kumar, talking about ecosprin, of course, this is Dr. Prakash answering about aspirin, mainly because these people who have undergone recently heart surgery, those people are taking ecosprin. What is the role of ecosprin for a COVID patient? Also, is it mandatory for all? What's the question? I don't think it's mandatory for all.
No, it is not.
The guidance in the earlier guidance was, if patient was taking aspirin, continue to take it. But there is no need, or it's not even advisable to take it if just to treat something related to COVID. Anti-inflammatory system may not be working as similar to ibuprofen. They do not recommend. Usually they try to painkillers and the Tylenol are recommended more than NSAIDs. I mean, so non-steroidal anti-inflammatory agents are not really recommended. And
YouTube question, I think it's already answered. What is the main reason to evolve mucormycosis post-COVID treatment, which we already discussed this one? Is Fabiflu medicine is useful for COVID treatment? Fabiflu.
Tamiflu.
Yeah, is it useful for COVID treatment?
The symptoms of some of the COVID symptoms are similar to cough and all that. Depending on that is Tamiflu. I think it is available over the counter. So talk to the doctor and take it. It all depends on the symptoms. If you don't have cough, nasal congestion and all, you're not going to go there. Simple acetaminophen will do. So it all, like Shobha has said, the symptoms should tell you what to do. Okay, what to take.
Tamiflu, yeah. Again, coming to Tamiflu, Tamiflu was introduced by Roche in US to supplement as an adjunct to vaccination for flu. See, the word Tamiflu is to temper down flu. So it is only for flu, and also it reduces the symptoms and reduces the duration of the influenza virus vaccine symptoms by 1 to 2 days. I am not sure whether the activity or pharmacological action of Tamiflu as a unit, as a molecule, is anywhere effective in the COVID treatment. They are two different animals.
Okay, we got about 15 more questions. Let us move to the next one. Madhura Dathar says, again on vaccines, how immune are people who have taken single dose of vaccine? We know that it is 30 to 40% only antibodies are generated with the first dose. And do they have to follow the normal precautions to prevent this infection? Yes. You have not been fully developed antibodies. You have to complete the second course, then only you get 100%. The first one dose is only priming the body. It is not 100% developed. Second question from the same person, Madhura, is anticoagulant therapy given only in severe cases?
Dr. Jagdish, I have one thing. Please note that some vaccines are only 70% effective. For example, our flu vaccine is only 55% effective. mRNA vaccines effectiveness is more than about 94%. So other J&J and all 70%. So you have 30% chance of getting reinfected. So although you are vaccinated, don't say, hey, I'm done. You practice the good hygiene. Okay? Please practice the good hygiene. That's my comment. Thank you.
Just one comment picking up on a previous response. I think the question was about Fabiflu is Favipiravir, I think, which is only approved in Japan and India. So I think we mistook that to Tamiflu, which is more of, so this
spelling mistake is
Favipiravir.
At least don't have experience on that.
Right.
Okay, next one is from Varun. In general, some are affected by fungal infection. Is there any risk if they get contact with the COVID? Fungal infection, people getting contact with the COVID.
Yeah, their immune system is down.
Yeah,
exactly. Of course. If you're not healthy, contact with COVID is very bad. And it attacks the people who are not healthy, obese, diabetes, and all that. So that is why, how we all recover everything depend on your health condition. Yeah. If you have fungal infection. Yeah.
Fungal infection is indicative of the condition, immunocompromised condition. So when you are already immunocompromised, you are likely to be susceptible to further infection. So it is just a precaution, just to be careful. It's a warning, actually.
They are more prone. They are more prone for the infection because they are already immune compromised.
Perfect. That's what.
They are more prone.
Nabina Sami asked question. Definitely one should take, because is it mandatory to take second dose of AstraZeneca vaccine, or can we just ignore without taking it? No, this is a very bad thing. You must complete the course. You cannot ignore it. Just like antibody, taking only for 3 days and not completing the course of 10 days. No, you must take the full dose, 2 doses.
AstraZeneca is only 70% protection. So with the 2 doses. So again, same mantra. Be careful. Even you are vaccinated, be careful.
Can anybody tell about the DRDO's 2-deoxy-D-glucose, which we explained, which we talked last week, last session, 2-deoxy-D-glucose drug, which was approved by ICMR for COVID?
No, it's me. I don't know about that one.
So Dr. Jagdish, we have not seen the clinical data. Maybe what, as a follow-up action, what we should do is we should search if there is a clinical data from already Pharmaceutical showing improvement versus placebo or large number of population. Some clinical data should be there. No. Mechanisms, statistic action versus actual clinical.
There are some clinical data available. Without that, ICMR will not give approval. This clinical data indicates that it gives a false glucose. Thereby, it prevents the multiplication, and clinical data says that it improves the patient condition earlier by 2 to 3 days. Instead of 7 days, it cures the patient by 2 to 3 days earlier to these things, and thereby the third phase of the clinical data is not yet completed. However, the initial results of the third phase of clinical data is available. On the basis of that, ICMR has given permission, and now manufacturing is going on. Preliminary 10,000 pouches have been released. Probably in the first week of June, they will be releasing for the public. This is what the information we got in India.
So the mechanism looks very good. Mechanism, no doubt.
Yeah, I agree that. I agree that it appears to be a very important mechanism through which this drug is acting, but I think we should continue to track how it's working, even though it has been given initial approval.
Yeah, even Gilead's antiviral studies they did, they said it helps by a patient's 5 days duration, means to stay in the hospital is reduced by 5 days. Okay. That's what this initial data said.
Next question.
I think last question, can attenuated COVID vaccines avert back to virulence?
I don't think, because a lot of vaccines are based upon the attenuated virus, not only this one. You can think about previous other vaccines also that Bharat is already manufacturing. They're all attenuated viruses we are using. Even for the flu vaccines, which are using is attenuated virus. I don't think it causes any virulence.
Okay, if a person takes a vaccine dose.
Yes, the answer is yes, you should get vaccinated, even if you were asymptomatically COVID infected, because yes. Especially because if you are asymptomatic, then it's likely that the only thing that happened was that your innate immunity protected you from going on to more severe symptoms. And so you do not have adaptive immunity. You do not have antibodies. So it is important to take the vaccine if you, to the question that Tarun just asked. Are we at the top of the hour? Should we keep going or?
No, somebody one person asked question saying that I'm hearing so many rumors that taking vaccines leads to death of a person. Is that true? This is a very bad thing, saying that I'm hearing so many rumors that taking vaccines lead to death of a person. No, that is not true. So that is a rumor. People making stories.
Sir, there are no questions. Now I ask Manoj to take the mic and call for the vote of thanks.
Oh, wait, 1 second. Before that. I would like to acknowledge the AAGCPA leadership for this platform and for this opportunity, specifically Mr. Ravindra, Dr. Parab, Dr. Jagdish, and also Mr. Kadambi for this opportunity, and you too, Dr. Ramchandra Shetty. Thank you everybody for engaging in this dialogue and for your time with us today.
Thank you.
Manoj.
Thank you so much, ma'am, everyone. Thank you so much. Dr. Chelvraj, sir, you are there? Dr. Chelvraj?
If he's Chelvraj, if he's not there.
Sir, I'm there.
Yes,
please present the vote of thanks.
Thank you.
Good evening all, sir, and good morning to all. I take this opportunity to give a vote of thanks, and on behalf of Pharmaceutical Society of Government College of Pharmacy, National Service Scheme of Government College of Pharmacy, and also AAGCPA. So, first of all, I would like to thank Dr. Shobha Bhattacharya Madam, Shobha Bhattacharya Madam, for throwing a light on the COVID treatment in-house as well as in the hospital. And also Dr. Jagdish sir, who is a mentor for the present events and the backbone of the topic and ongoing events. I thank you very much, sir, for moderating the session in a wonderful way. And also Prakash Parab sir, who was a speaker of the last session and also interacted nicely with giving the scientific answer. Scientific answer for all the questions were arised by the participants. Thank you very much, sir. And I also thank our beloved principal, Dr. Ramchandra Shetty, sir, for giving us an opportunity to host this particular program, an online platform under the banner of NSS as well as AAGCPA. He has made all the students come on a single platform and get the answer for the queries and also to meet the experts. Thank you very much, sir. Also thank Mr. Manoj, who is our distinguished alumni of our college. Of course, people who are all involving here, they're all our alumni and our senior most officials as well as our seniors. Manoj has given a platform, technical LPS provided to coordinate the AAGCPA and Government College of Pharmacy. Thank you, Manoj. And also I thank all my teachers, all my seniors, and all alumni who are in the group for for attending this particular session. Also thank all the students and other participants from the other colleges. Thank you very much, sir. Thank you, sir. And also we request, sir, to have these kinds of program in the future, more and more programs, so that it will bring all the alumni in one single platform, so that we'll be united, sir. Please give your valuable suggestion for the implement of our budding pharmacist and also for the implementation of the college. Thank you very much, sir. Thank you for giving an opportunity to give a vote of thanks and propose my views. Thank you, sir. Thank you all.
Sir, I have got one request. If anyone of the participant have the contact details of Srikanth Annappa, please share it me. I will talk to him to have his lecture as the 4th lecture in this webinar series. In 2 to 3 days, there will be a 3rd lecture. I will let you know the timing and date. Please share me the contacts of, if anyone has got the contact of Srikanth Annappa Pai. Thank you, one and all.
Should have only a Saturday morning. That would be nice. Saturday afternoon for you people, Saturday morning for us. That would be a nice one.
We shall see, sir. We shall see what best can be done.
Yeah. Not between Monday and Friday mornings. Okay, thank you.
Yes.
Thank you, Principal Shetty. Thank you, everyone. Thank you, Manoj. Thank you. Namaskar.
Thanks, Manoj. Thank you so much. Appreciated.
Yes, sir. I'll be sending an email to all of you on the comments people have sent, and also feedback on the session. Some people are requesting some new topics, so I'll be compiling everything and sending an email to all of you. Thank you so much.
Thank you.
Thanks, Manoj. Keep it up.
Thanks,
Thank you,
everyone.
sir. Thank you, sir. With your permission, I'm closing the session, sir.